Low Back Pain Complete Guide. Introduction and Epidemiology. Low back pain is one of the most common health complaints worldwide. In fact, nearly 1 in 4 people experience lower back pain every month, and around 80% of people will deal with it at least once in their lifetime. It often begins between the ages of 20 to 40, while repeated episodes are more common in adults aged 40 to 80. Low back pain can be classified based on duration. Acute, less than 6 weeks. Subacute, 6 to 12 weeks. Chronic, more than 12 weeks. The good news: most cases improve within 6 weeks. Causes of low back pain. Mechanical causes. Low back pain has several causes, but the most common type is mechanical low back pain, responsible for about 97% of cases. Mechanical pain usually gets worse with movement, improves with rest. The most common reason is muscle strain or ligament sprain, making up around 70% of cases. Strain, injury to muscle fibers. Sprain, stretching or partial tearing of ligaments. Other mechanical causes include disc degeneration, facet joint problems, herniated disc, spinal stenosis, spondylolysis, compression fractures, sacroiliac joint dysfunction, scoliosis. Pain patterns also help identify the cause. Pain worse on bending forward gives often disc-related. Pain worse on leaning backward gives often facet joint-related. Sometimes low back pain travels into the leg. If a nerve root is irritated, this may cause sciatica or lumbar radiculopathy. Referred low back pain. Not all back pain comes from the spine. About 2% of cases are called referred pain, meaning the source is somewhere else in the body. Examples include abdominal aortic aneurysm, acute pancreatitis, kidney stones, kidney infection, shingles. In females, possible causes also include endometriosis, ovarian cysts, pelvic tumors. Systemic causes. A smaller group, around 1%, comes from serious systemic conditions. These include inflammatory arthritis, ankylosing spondylitis, psoriatic arthritis, bone infections, spinal abscess, cancer spread to bone. Common cancers that may affect the spine include lung cancer, breast cancer, prostate cancer, thyroid cancer. Interestingly, even after full evaluation, about 80% of patients still have no exact structural cause identified. Red flags. When to worrying. Some symptoms need urgent attention. These are called red flags. Watch for numbness around buttocks or groin saddle anesthesia, loss of bladder or bowel control, sudden urinary retention, leg weakness or neurological deficits, fever, unexplained weight loss, night sweats, severe trauma, history of cancer, osteoporosis, immunosuppression, for drug use, pain that wakes you from sleep, does not improve with rest, should always be investigated. Emergency conditions include cauda equina syndrome, spinal cord compression, spinal abscess, internal abdominal emergencies, diagnosis, history and physical examination. Diagnosis starts with a detailed history and physical exam. Doctors inspect for abnormal posture, curvature changes, scoliosis, kyphosis, deformity. They also check tenderness, mobility, active movement, passive movement. Pain during movement gives clues. Pain on forward bending with leg radiation gives disc herniation. Pain on backward extension gives facet joint or stenosis. Special tests include straight leg raise test, used to assess disc herniation. Pain below 60 leg raise may suggest nerve irritation. Femoral stretch test helps assess upper lumbar nerve involvement. Sacroiliac joint tests. These include thigh thrust, distraction test, Genslin's test, pelvic compression, Faber test. A full neurological exam is also essential. Don't forget, hip problems can mimic low back pain, so hips should also be examined. Lab tests and imaging. Most patients don't need scans immediately. Lab tests may include complete blood count, C-reactive portion, erythrocyte sedimentation rate. Imaging is usually reserved for red flag symptoms, suspected fracture, persistent pain beyond 6 weeks, neurological deficits, common imaging. X-ray gives fractures alignment. MRI gives nerves, discs, spinal cord. CT scan gives trauma evaluation. Treatment. Treatment depends on the cause. For acute mechanical back pain, first-line management includes reassurance, staying active, avoid prolonged bed rest, heat therapy. Additional helpful options: massage, acupuncture, spinal manipulation, physiotherapy. If medication is needed, 1. Non-steroidal anti-inflammatory drugs. 2. Paracetamol. 3. Stronger pain medication if necessary. Muscle relaxants may sometimes help. For chronic low back pain, treatment focuses more on exercise, strengthening, posture correction, physiotherapy. Advanced options may include radiofrequency ablation, injection therapy, surgery in selected cases. Low back pain is extremely common, but understanding the cause is the key to proper treatment. Most cases improve with conservative care, but red flag symptoms should never be ignored. Thanks for watching. If you found this video helpful, please like, share, and comment. Your support motivates us to create more physiotherapy and health education content. Don't forget to subscribe, and I'll see you in the next video.